Have you heard of edging? Well, today we're going to talk about it. Welcome back to the Rena Malik MD podcast, your source for evidence-based information about your sexual health and more. I'm Dr. Rena Malik, urologist and pelvic surgeon, and welcome back to our monthly Ask Me Anything. These are questions taken from our premium subscribers who ask us questions that we answer in a full-length video and audio for our podcast. We only share half of it for free, and if you want to get the whole episode, make sure to sign up for the membership at renamalik.supercast.com. There you will also get access to Ask Me Anything, early episodes of the podcast, as well as transcripts. Now, without further ado, let's get into it.
All right, first question. What exactly constitutes someone to be classified as having a micropenis? Like, how small is too small before they get diagnosed with this?
Okay, so micropenis is defined basically on population-based data. So they look at measurements from penile length from multiple individuals across the world and multiple studies that have been done to give you sort of a bell-shaped curve. And when you look at the people who are at the least 2.5% of the population, that's where you determine micropenis. So in this case, micropenis is defined as less than 2.95 inches when it is stretched. So stretched penile length is often used in research as a surrogate of erect length because what we found is it very strongly correlates with erect length. So most people who have issues with penile size are not actually those who have micropenis. Oftentimes people who are worried about their size usually have an average size penis. So it's about 5.2 to 5.7 inches is sort of the middle of the road or average. And so most people fall into that category. But because of the way our society is so obsessed with penile size, people find themselves obsessing over this. But what's really important to understand is that penile size has very little to do with pleasure. In terms of pleasure, if you're with a female partner, the organ of pleasure for the female is the clitoris. It's not the vaginal canal. And so the clitoris can be stimulated with or without a penis, right? It can be stimulated with fingers, with oral, with vibration, with toys. Those things are what are going to help you in allowing for your partner to have pleasure. We're talking about pleasure for men. The size of the penis really doesn't correlate with how strong their orgasms are, how good it feels, what their sensation is like. That really doesn't matter. What matters is the health of the tissue, which we'll talk about later in this episode. But ultimately, when you want to pleasure your partner, what I tell people is to ask them. You want to know, what are they into? What gives them pleasure? What do they like? Help them show you what they like so that you can then incorporate that in your intimate time. And also, foreplay is so important in sort of cultivating desire. When you have higher desire, you ultimately have higher arousal and stronger and more intense orgasms. And that's what it's all about, right? So what I often say is that foreplay starts in the morning. It starts long before you're going to be intimate with your partner. It may be a little text, flirtatious text. It might be a little graze or a touch of the person on their back or on their shoulders, but just a reminder that, hey, I think you're attractive. I think you're sexy, and I can't wait to be intimate with you. And that gets someone excited. And oftentimes when you're meeting people, we get so fixated on the act of sex, of penetrative intercourse, when there's so much more at play.
All right, next question. I'm a 53-year-old male. I still have sex, but started having some mild erectile dysfunction. I'm obviously nervous about this because I don't want this to progress and interfere in my sex life. What are things I can do to reverse mild erectile dysfunction or to overall improve my sex life into old age? I want to be able to have sex for as long as I am alive.
I love this question. And the reason I love this question is he asked, how can I reverse this problem? And when you come to see a doctor and you ask for a medication like sildenafil or tadalafil, those are just Band-Aids. They are just helping you being able to have sex in the moment. They are not reversing the problem. Now, in order to reverse the problem, you need to think about why you have erectile dysfunction in the first place. And the number one cause of erectile dysfunction is vascular. 70% of the time, it is vascular dysfunction, meaning that you have things like high blood pressure, high cholesterol, diabetes, all that affect the health of the blood vessels to the genitals. And this is really important because if you can improve the health of your blood vessels, you will not only improve the health of your genitals and reverse the erectile dysfunction, but you will also prevent yourself from progressing to having heart disease or heart issues. Because we know that when people start having issues with erections, this is a canary in the coal mine. This predates any issues with heart disease for 2 to 3 years. And when you look at guys with erectile dysfunction, up to 14% of them will have a heart attack within 7 years of being diagnosed with ED because their vascular disease just continues to progress. And so how do you reverse erectile dysfunction? The same way you improve your overall heart health. You're going to optimize your diet, you're going to exercise, and you're going to stress reduce, and you're going to sleep well. All these main pillars are going to help you overall reverse erectile dysfunction. Now, importantly, things like exercise are so underrated. Even 150 minutes of aerobic exercise a week are as good as taking a pill of sildenafil for erectile function. And so it's so important to, one, see your primary care doctor, to get evaluated, so get your lipids checked, get screened for diabetes, make sure that your insulin resistance is appropriate. All those things are in check and you're doing well in those areas. The sooner you figure out that you have an issue and the sooner you work to reverse it, the better off you will be. Now, in terms of other options that you can do in terms of reversing erectile dysfunction, there are some now regenerative therapies, which work to sort of reverse the problem. One of these is called shockwave. And so shockwave is something I offer in my practice. It essentially uses sound waves to create mechanical trauma to the erectile tissue. And this then tells your body, hey, we have something's going on here. We got to fix it. So it sends growth factors like VEGF, which help produce more blood vessels in the tissue. It also sends stem cells to the area to help regenerate good, healthy tissue. And so this is one of the ways that you can reverse the problem, but it's only so far seen benefit in guys who have mild to moderate ED and who have it due to vascular problems. So if you're having erectile dysfunction due to prostate surgery, due to medications, it's not going to help in those patients. Now, of course, other things to know is if you're taking medications that might cause erectile dysfunction, get your testosterone checked to see if you have a low testosterone, which can make the issue erectile dysfunction worse, and make sure you have no other comorbid conditions like neurologic diseases or vascular diseases that you can optimize or manage better so that you can improve your erectile dysfunction, prevent any worse progression of erectile dysfunction. It comes down to things that are not really sexy: diet, exercise, sleep, and stress reduction. So important.
All right. What's the deal with edging? Does it really create a more powerful orgasm, or is it just hype? Maybe we should just describe what edging is first.
Yeah, so edging is essentially the practice of getting close to climax. So you start feeling you are about to climax, but you're not quite there yet, and then you back off. So you might decrease your stimulation, you might take a little, like a short break from what you're doing, so that brings that arousal down just a little bit, and then you resume and continue to start arousing yourself and going towards climax, and again, sort of tamp it back, and then go again. Now, some people find this to be a very effective way to sort of continue that sensation of pleasure, of feeling really good right before you're about to climax. And some people really have stronger and more powerful orgasms because of it. Now, it's really important if you're going to edge with a partner that they're on board, because it can be very frustrating if the person's not aware that you're going to practice edging, and they might get very frustrated with you rather than actually being aroused and enjoying the process. So one is make sure your partner's on board, always have consent, but communicate about it. Now, there's one situation where I would say edging is something you want to be thoughtful about. So sometimes when people are edging, they're really trying to sort of clench down and prevent orgasm or ejaculation from happening. And when they're doing that, they're tensing up their pelvic floor. Now, if you're doing this over and over again, multiple times a day or multiple times a week, and you're starting to notice that you're getting pain in the genitals, or maybe you're starting to notice that your erections are not as strong, or you're having urinary symptoms, like maybe you're going more often or more urgently, or you're starting to find that you're constipated, these might be signs that your pelvic floor is actually not relaxing in between this. So it's getting more tense and it's not relaxing. And so in those cases, I'd say hold off on edging. We need to fix these issues with your pelvic floor so that it can function normally again. Because what happens is when you essentially are getting towards climax, your pelvic floor is tensing up. And when you climax, that pelvic floor contracts at about every 0.8 seconds and then it relaxes, right? And so we need to have intermittent relaxation in any circumstance, right? You're not just going to keep lifting weights if it hurts and not take a rest day. It's the same thing for your pelvic floor.
All right. Do women get morning wood?
Yeah, so that's a great question. Do women get morning wood? Now, a lot of you guys are like, what? How could she get morning wood? She doesn't have a penis, right? But actually, we do. We have a clitoris, and the clitoris is the homologue of the penis. So when we're developing in utero, when we're little fetuses, before you're sexually differentiated, you have a genital bud, and that genital bud goes on to develop into either a clitoris or a penis, and it has the exact same structure. Now, the clitoral glands that you see is homologous to the penile glands, but the clitoris is not just that little bud. It has a shaft, just like the penis does, which extends deep underneath the pubic bone and then goes down, just like the male penis. They look identical. When you do cross sections in anatomy, they have the exact same erectile tissue that fills with blood and engorges during arousal. And so just like guys have morning wood and they have 3 to 5 nighttime erections every night in healthy guys, the same thing happens to women. They have 3 to 5 nighttime episodes of clitoral tumescence, and they can wake with morning clitoral tumescence. Now, it's not as obvious for a lot of women because it's not outside their body. It's not protruding. And so while they can have it, it's often just not as noticeable. Thank you guys so much for joining us on today's episode of the AMA. If you guys want to hear the rest of this episode, make sure to check out renamalik.supercast.com and sign up for their premium membership. And as always, we're going to take care of yourself because you're worth it.